Hi, my name is Emma, and today I will tell you something about autism. What is actually an autism spectrum disorder? An autism spectrum disorder is a pervasive developmental disorder, accompanies affected persons and their families for a lifetime, and there is no cure, but effective support options exist. According to Freitag and collaborators, the terminology of pervasive developmental disorder was intended to make clear that it's persistent, severe, multifaceted disorder that affects the entire developmental course. In principle, the brains of people with autism work differently from those of people without autism. Let's make an analogy. A PlayStation game usually works without flaws on the PlayStation, and a Nintendo Switch game works flawlessly on the Nintendo Switch. But what would happen now if we try to use the PlayStation game in the Nintendo Switch and the other way around? We will probably fail miserably because it is not possible to use the two games in the respective other consoles. It is similar with people with and without autism. The games are not broken, but they only work to a limited extent or not at all in the other respective worlds or consoles here. Especially, the perception of people with ASD is associated with many peculiarities. Some people with autism have difficulties filtering acoustic and other stimuli according to important and unimportant information. This means that all stimuli are received unfiltered. In the picture, you can see Mia. Mia has autism. She is sitting in the classroom and is supposed to solve a task. Next to her sits Max. Max does not have autism. He is already concentrated on his task. Mia, however, has strong problems to concentrate. This is due to many stimuli that she cannot turn off. The buzzing of a fly, the open window, she hears the birds singing, the siren of the fire truck passing by the school, and many other sounds in the classroom that come out Mia unfiltered. While Max has no problem turning out these noises, Mia hears them all the time. Because of this, it is difficult for her to concentrate on her task. People with autism are often impaired in their central coherence. Central coherence is the ability to recognize details as belonging together. Here you can see Mia's aunt, Ella. Mia always remembers Aunt Ella by the birthmark on her face. If Ella had the birthmark removed, Mia may no longer recognize her aunt. In addition, people with autism can be hypo or hypersensitive. That means they are insufficiently sensitive or too sensitive to stimuli on their skin, smell, tastes, and many more. Possible examples of hypersensitivity are genes and pain associated with wearing them. It might be that the hard denim, the seams, or even other clothes and their special features can be very uncomfortable for people with autism. They may, for instance, feel pain while wearing them. Certain foods are also avoided by people with autism because of unpleasant sensations when chewing or swallowing. In addition, they often have a more pronounced sense of smell than people without autism. People with autism regularly show conspicuities in their following areas: social interaction and communication, stereotypical and repetitive behaviors. Examples of conspicuousness within social interactions and communication may include decreased eye contact and impairment within the interpretation and showing of nonverbal communication signals such as gestures and facial expressions. Many of the affected children do not play as if games, such as mother, father, child, or other role playing games. Within language development, there might be a delay. Some children with autism, in the sense of Asperger's syndrome, can speak before they learn to walk. In addition, they have a very extensive vocabulary and sometimes sound like little professors. The spectrum is very broad, from people with intellectual impairments to people with giftedness. Within the stereotypical and repetitive behaviors, the following examples may be characteristics of autism spectrum disorder. Rituals and routines are particularly important for people with autism. If these are interrupted or suddenly changed, affected individuals regularly show challenging behaviors of varying intensity. Children with autism often play with toys non-functionally. It is regularly observed in affected children that they do not, for example, drive a car along an imaginary road, but sort cars according to their size or color. In addition, many people regularly show stereotypical and repetitive movements. Stereotypical means always in the same way, and repetitive means repeating. Often, these movements are shown in a very exciting or stressful situation. Many of the affected people also have a limited repertoire of interest. They are interested in a specific topic and are very intensively engaged with it. The preoccupation with this area of interest can take up a large proportion in everyday life. That was a brief first insight into the topic of autism spectrum disorder. Remember, if you know a person with autism, you know exactly one person with autism. People with autism are as individual as people without autism, even within their symptomatology.